I consent to this video.
All right, so we're gonna start off with doing our assessment on this patient here. So first thing we're gonna do is just take a general look at the patient, look at how they're dressed, if their skin, any diaphoresis, if they're able to maintain eye contact, and how their speech is, and then we move on to our actual assessment. So we'll start with the skin. I'm just gonna take a look at the patient's skin, feel it make sure it's warm and dry. I'm also gonna do our skin turgor at the same time and check our nails for any clubbing, and check our capillary refills. Perfect, less than 3 seconds. And then I will move on to our head. So first thing I'm gonna do is just take a look at our hair. We look at hair distribution, texture. I'm making sure that our hair looks like it's evenly distributed, that we don't have any signs of male or female baldness. At the same time, I could also be checking for tenderness, any lesions. So I'm just gonna feel our head. Perfect. And at this time, you could also check for nevi, any lice, and then we'll move on to our face. So first thing I'll do is check our eyebrows, make sure our eyebrows are evenly distributed, our hair, that we aren't losing any hair at the end of our eyebrows, which can be a sign of hypothyroidism. And then we move on to looking at our eyes. So first thing I do is look at the conjunctiva and the sclera. I'm just gonna pull our eyes down. Thank you. Making sure that there's no redness, no drainage, no irritation. Check our lacrimal glands at the same time, and then our eyelashes as well. Again, we're just checking to make sure the eyelashes are evenly distributed, and there is no eyelash loss. And then I can move on to looking at our our eyes. So we can check our pupils first. So we're gonna make sure that our pupils are round and reactive, and that they constrict. So I'm just gonna have you look at me, and I'm just gonna check our pupil dilation. Perfect, and then do the same thing. Perfect, and now I'm just gonna check to make sure our eyes accommodate. So, perfect. Perfect. Oh, I just misspoke. So that wasn't accommodation. That was, we're checking for constricture. When I flash the light on one eye, we can check to make sure the other pupil also constricts. So for accommodation, I'm gonna look at my finger and I'm just gonna bring it closer. Perfect. Do it one more time. Follow my finger. Perfect. And we're just making sure our eyes converge and our pupils constrict. Okay. And now I'm gonna take a peek at our optic disc. So I'm just gonna check first. We're gonna do both eyes. So her right eye with the right of my eye, and I'm gonna set our fundoscope to 0, and then can adjust accordingly, whether I'm looking at the anterior or posterior pathways. So I'm gonna look at our right eye. So I'm just gonna get a little bit close. I'm gonna put my hand on your shoulder. Perfect. Alrighty, and then I'll do the same thing with the other eye. Perfect. Alrighty, and then I'm just checking our optics discs and making sure that it's sharp. There's no signs of papillary edema, any AV nicking, any hemorrhages, which can all be signs of hypertension or diabetes. Okay. So next, from the eyes. Well, while we're still on the face, I'm also just going to check our maxillary and our frontal sinuses for any tenderness. So I'm just going to palpate. Any tenderness?
No.
All right. Any tenderness?
No.
Perfect. Alrighty, and then now I can take a look at our nose. I'm just going to switch this out real quick. So when we look at our nose, we are just checking our septum, making sure it's not deviated. Okay, just gonna look. Perfect. Perfect. So again, I'm looking for any septum deviation and looking at the color inside of our nostrils. If it's white and boggy, that can indicate allergies, and if it's red and inflamed, that can indicate infection, like a viral infection. And then we can move on to our mouth. With our mouth, we're looking first at our lips, our mucosa, making sure it's not, our lips aren't dry and our mouth isn't dry. And I'll just have you stick out your tongue first. Perfect. I'm just making sure that her tongue protrudes midline, that there's no deviation. I'm just gonna look down. I have my light on. Perfect. And then we check the tongue for any lesions. Thank you. And then you can put it back up. Thank you. And then when we look in the mouth, we also want to make sure that the uvula is, when we open our mouth, is midline, and that we can see our tonsils, and +1 or +2 is normal, and that there's no exudate, no redness. And then all at the same time, as we're looking into the mouth, we're looking for any missing teeth, any lesions that we see on the side of the mouth, cavities, things like that, of that nature. All right, and then now we can move on to our ears. So first we do just an inspection of the ears. We're looking at the auricle. We're looking for any obvious lesions, because this is a sun-exposed area. Looking for any signs of sun damage or anything that can be cancerous. We can also at this time feel our mastoid. So, and we feel for tenderness, which can be a sign of mastitis. We also can feel the tragus, push down on the tragus, and then pull down to do the pull test. And again, we're assessing for tenderness, which could be a sign of infections like a swimmer's ear. And then we can look inside of the ear. And when we look inside the ear, we're looking at, we're looking for any fluids, any redness, anything that can be a sign of infection. So we can look first, we're gonna look for the cone of light, and then the other landmarks. So the malleus, and that will be what we should see with the cone of light. Sorry. Perfect. And we would do that same assessment on the other side, same thing, looking for any fluid, any exudate, any redness. Okay, and so now we will move on to, we can do our neck. So with our neck, first thing we're gonna do is I'm gonna look to find our thyroid gland. So that's gonna be, it's gonna be underneath the thyroid cartilage and the caracoid cartilage. So I'm gonna just put my hands right here. And first thing I'm gonna have you do is just swallow your saliva. Feel perfect. And when we do that, we're feeling for any goiters or any nodules in our neck. And then we also assess that our trachea is midline. Okay, and so now I can move on to the last part of our neck is we're gonna just do our sinuses in our face. So I'm just gonna feel for any tenderness, any nodules, any that are gonna be mobile or discrete. So I'm gonna start with our preocular, posterior ocular, posterior cervical, posterior, supraclavicular, superficial clavicular, submandibular, submental, our deep cervical chains, our occipital, and then our tonsillar. Okay. Alrighty, and then now we can do our deep jugular distension. So if you could lay down, and we're gonna be on our left side, so that's perfect. Just have you lay, and then have you face your neck this way, to your left. Perfect. Alrighty, so we are checking from our, around this side. We're measuring from our carotid artery with the point of Louis. So we find our, from the left side, our carotid artery, and then point of Louis. Oh, let me change this. And we measure the size of this, and anything greater than 3 centimeters is considered abnormal. Okay, perfect. And we can sit back up. Alrighty, and now I'll move on to our cardiac assessment of this exam. So first thing I'm gonna do is I'm gonna have, I'll put my hands on the patient's chest, and I'm gonna be looking for any heaves or lifts. So it means with my hands on the chest, I'll look to see if my fingers will lift, and then I'll also be at the same time assessing for any thrills, so any palpitations with my hands on the chest. So that's okay, I'm gonna put my hands right here. Perfect, okay. And then also I can move on and check my carotid artery. So first thing we do is we listen for the carotid. So I'm listening for any bruits. So I'm gonna just have the patient take a deep breath and just hold it for a second, and I'll listen with the bell of my stethoscope. Okay. Perfect, exhale, and then deep breath in, just hold for a second. Perfect, alrighty. And then when we don't hear any bruits, you can breathe, I'm just going to now palpate those. So we do one artery at a time. Perfect, and I'll check the other side. And we have a strong carotid pulse. All right, and so now I can go ahead and listen to our heart sounds. So we'll start with the aortic artery. So with the aortic, we're gonna listen to on the second intercostal space right of the sternal border, and then our pulmonic valve, which is gonna be second intercostal space left of the sternal border. Then we will listen to our Erb's point, which is our third intercostal space left of the sternal border, our tricuspid valve, which is the fourth or fifth intercostal space left of the sternal border, and then lastly our mitral valve, which is our fifth intercostal space mid-axillary line, which is also called our point of maximal input, or the apex. Okay, so I'll listen with both my bell and my diaphragm. And then with female patients, you would typically lift up their breasts into underneath to get to some of those points like the apex. And then I would also listen, like I said, with our bell as well. And so things we're listening out for is for our heart sounds. We're listening for any murmurs. We're checking the rate and the rhythm, any abnormal heart sounds, and things like murmurs. Okay, so that is it. Oh, and one more thing for murmurs. When we are listening for specific murmurs, our aortic murmur, we're gonna hear best with the patient leaning forward. So that is the one that's gonna be on our second intercostal space right of the sternal border. So I'll just have the patient just take a lean forward. Perfect. Okay, lean back. And that's where we best hear our aortic murmur, and then we can listen to our mitral murmur, which will be best heard laying down on the patient's left side. So if you don't mind just laying down for me. All right, perfect. Then we can sit back up. Alrighty, and then now we can move on to the lung portion of the assessment. So first thing we do is just assess the patient with our eyes. We're just looking at increased work of breathing, respiratory rate, if we're noticing any contractions. If we're working with any, if patient has any physical positions that they're using to breathe a little bit easier. And so we're gonna start with looking at that, and then we can do check our thoracic expansion in our anterior and posterior side. So I'm just gonna put my hands on your back and then have you take a deep breath, and I'm gonna watch for right underneath the scapula, and I'm just gonna watch to make sure that with the deep breath in, both of my hands rise equally. So deep breath in. Perfect. Alrighty. And that's equal. And I'll do the same thing. I'm gonna put my hands just right on your chest and have you take a deep breath in. Perfect. And our chest rises equally both times. And then we can now palpate. So with our palpation, I'm gonna do the anterior and posterior side. I'll start with the front, and I'm just gonna have the patient say 99, and I'll do it at 3 different spots in the front and 4 different placements in the back. So I'll just have my hands in various parts of your chest and your lungs, okay? So 99.
99. 99. 99.
Okay, and then I'll go on the other side. And same thing.
99. 99. 99. 99.
Perfect. And now I can do, I'll stay here. Now we can do percussion. For this portion, we're just doing percussion to check our diaphragm. So I'm gonna have the patient, when I do this, take a deep breath, and I'm going to percuss down their right side to feel for dullness, or to listen for dullness rather. Okay, so take a deep breath, and then when I'll start percussing. Okay, and then I'm gonna do that one more time, and this time actually just hold your breath when you take a deep breath, okay? And take a deep breath. Okay, perfect. And then we're measuring the difference between that, and it's usually between 2 to 3 centimeters for the diaphragm. Okay, and then the last part we'll do is we're just gonna listen to our lung sounds. We'll auscultate. We're listening for any abnormal lung sounds, things like wheezes, coarseness, crackles, and we'll compare both sides. In the front, we'll have 6 points that we'll listen to, and on the back, we'll have 7, and we're going in a ladder pattern to compare both the left and the right side. So we'll listen with both the diaphragm and the bell of the stethoscope. So just take a deep breath when I have the stethoscope on you. Okay. And then deep breath. And then I would do the bell as well, and then we move on to the back, and we'll have our 7 sides. So deep breath. Okay, perfect. Alrighty, and then that's it for our respiratory part of the assessment. And the last thing we're gonna do is just check our peripheral pulses. So first what we usually start off with is looking at our lower extremities. We're checking our legs. We're checking the hair of our legs, if there's any shininess, any hair loss. Perfect, and then we're also looking for any edema, any varicose veins. Oh, you're totally fine. Sorry. No, you're fine. I only need 1 foot. Alrighty, so first I'll start with our brachial pulses, and we can compare both sides as well. We're just making sure that our pulses are strong, that they're not thready or pounding. And then we check our radial pulse. We'll do our popliteal, which is right behind our knee. Perfect. And then we do the dorus medialis. And then the posterior tibia right above the ankle. And then we would also check the femoral pulses, which is right in the groin, but we won't be doing that. All right, and that's it.